Welcome to Health Center from Downstate Medical Center. This is Gerald Deas, presenting cases that you might be interested in or information that's extremely important for your health and how you might be treated, or whether you like your doctor or whether you don't like your doctor. All these kind of things I try to bring on this program so you can get a good idea when you do meet your physician. There's certain criteria that you should have when you meet him or her that you feel comfortable. I mean, because they are the provider of your health, and you don't want to walk in there sweating, and you don't want to walk in there and rushed or what have you. 1 minute is a long time if you talk to a person with some sense. 1 minute. I used to spend sometimes I only had 3 minutes maybe to talk to a patient, might be not treating a patient, but just talking to them. 3 minutes is a long time. You can get a lot of information in 3 minutes. But today, we're going to talk about family practice. The importance of family practice. It's going to come back. When I say come back, it's on its way, because the super specialists are good, but they're not the total answer to family care or to medical care. And so I have Dr. Inger here today from Family Practice, who will give us a little insight into his treatment of patients, and knowing his background and so forth, which he'll give you an idea what he went through in a sense to be that doctor that will take care of you. So Dr. Inger?
Thank you for having me.
Nice having you with us, Dr.
Pleasure.
Inger. Dr. Inger, oftentimes I see you walking down the hall in Downstate Medical Center with your wife sometime and so forth. But right. The thing is that you're in family practice. What ultimately made you choose family practice?
It's the bond that you have with the patient.
Okay.
It's really that was the main thing, the driving thing. And to tell you a little bit about myself, I was in a med peds residency. I did that for 1 year in internal medicine and pediatrics. And though I liked it, it was intellectually very stimulating. It felt like almost like a factory at times. It was just like, let's get them in, let's get them out.
Right, yes.
And that connection, like that, finding out what happened to Mrs. Jones and all these things that happened to her, you make that connection for 2 or 3 days, and that hospital visit's so short, you don't know what happens on the flip side of things.
Surely.
So I was actually going to work, as a newly minted physician,
right.
But I was feeling very disconnected and very dissatisfied. And I made a very hard choice at that time, but it proved out to be the best choice in my professional career, was to move over to family medicine to get that continuity of care, right. Which is really the key, the continuity, just to kind of take these patients out throughout their experience and really develop that bond and things like that. And we were discussing earlier, it's not that you have to know everything, but you just have to really be there for the patient. And that was something that I really lacked during my first year. And then as I progressed in my second, my third year as family medicine, by the end of my third year, I had patients who were crying and things like that. That's because right. When I was leaving, and it struck me very close to my heart, and I was just like, wow, this is the thing that I was looking for.
Yeah.
And within two very quick years, I was able to develop that bond and that rapport, and I was like, wow, this is really going to make for something great if I expand out 10, 20, 30 years.
Oh, yeah. And because I always tell folks that you might be able to do medicine like, say, emergency medicine. Some folks are choosing emergency medicine. You get it, maybe you only have to work 9 hours or 8 hours, and then you're off, and sometimes weekends off. But a family practitioner is there 24/7.
That's true.
Most of the time, at least if they're going to answer the phones and things like that, But a little more of your background, because, in family practice, folks don't realize the extension of information you have to get by other fields that you might have participated in even prior to ultimately becoming a family practitioner.
Right. As an undergrad, I majored in nutrition.
Right.
And that gives me a little bit different perspective. I also subsequently did an MPH before I did medical school, and that kind of really fostered me to kind of really look at things in a little bit more global and broad view.
Where was the MPH at?
I was at UMD&J.
Okay.
In New Jersey.
Right.
And it enabled me to really look more broadly and look at what it really encompasses a person's health. It's not really just the person and the disease. It's really the other things that really kind of go along with it. It could be their social situation, what the political environment that's going on around it, their work environment, the types of food, the types of exercise.
Surely.
And really that really colored my perspective onto really kind of figuring out that it's not just the disease and the individual. I mean, that's a big part of it.
Surely.
But there's other things that go along and play along with it. Even after we make a diagnosis, say like diabetes,
Surely.
we have to take into account what kind of things that this person has to deal with,
Surely.
as far as what kind of environment they live in,
Surely.
what kind of access they have to medical care to see us, what
Right.
kind of access they have to the different recommendations that we give them as far as like diet.
Sure.
You know, they might not be able to afford some of the things
That's right.
that we're talking about.
And then sometimes a diet be a nice sheet, but everybody can't read the sheet. 'Cause sometimes it's so complicated, you know. And,
Absolutely.
But not only that, the thing is that, like you said, bonding with the patient, the healer and the healee. That, you know, there's a book called Therapeutic Touch by Dolores Krieger from NYU, and she showed that you can put your hand around a patient as this and get certain feelings, not touch the patient, how they are feeling or what they have almost. And she was showing diagnostically how you can pick out liver disease and this thing and that, even before the patient opens their mouth. But there's a certain spiritual thing that takes place that person. I always tell my students that medicine is the only place where a person will meet you in 5 minutes and take off all their clothes.
Right.
You know,
Absolutely.
There's no other profession that gives you the privilege, in a sense, to look at their body, in a sense. And that is a very sacred thing when you think about it, because we don't know who comes into medicine, who leaves medicine, but the thing is that's so important. But continue. I understand even that you got involved in sports medicine.
I did. I did a fellowship after my family medicine. I did a fellowship in sports medicine. And it's not because I really wanted to be connected with teams. I thought that was very interesting.
Right.
I just felt that it would add a different dimension to my family medicine experience, because a lot of our complaints that we see are musculoskeletal based and things like that.
Sure.
And they don't need to be necessarily treated by an orthopedic surgeon who would make trying to rush to surgery. There's a lot of things that we could do that are non-surgical.
Sure.
But we definitely have a place for orthopedic surgeons. It's just that, like, in family medicine, you know, there are a lot of times where we have like complaints between 10 to 25% of our complaints are neck, back, shoulder, knees,
yeah.
and things like that. And I felt that I need to kind of brush up and get better at some of those clinical skills and help my other colleagues to kind of
Sure.
to kind of get better at those things.
In fact, you know, at one time, Downstate was the seat of acupuncture. Dr. Wong, he was the head of the, he left, he was a PhD, MD, but he was an expert in acupuncture. If they had continued that, and that's when I was in school, we would now be the seat of acupuncture in the country, maybe.
Yeah.
Because acupuncture is just another field that we don't touch hardly in medicine as such, or use it, but it can do wonders.
Could do wonders. Absolutely.
For pain other than the pill.
Absolutely.
You know?
And actually, I'm taking an acupuncture course here at Downstate. it's funny you should say that.
All right.
With Dr. Chow.
Okay.
But that's another way that family medicine is really great.
Surely.
It definitely enables me to kind of look at different modalities and kind of keep like a very broad perspective.
Yeah.
Look at different cultures. Look at the way that they kind of incorporate medicine, like you were saying,
Right.
you know, from the traditional Chinese medicine point of view, from different points of view, and that's something that's very powerful, because a lot of the clientele that we deal with at Downstate is not inherently native to United States. They come from a different culture and things
Right.
like that, and so it definitely gives you that perspective to kind of really kind of look at things in different ways and different modalities. And even our treatment for diabetes and things like that, we have to take it into account that there's certain, like we have a large Caribbean population.
Sure.
Like, what are the Caribbean diets and things like that? What do we have to specifically target as far as their specific diet is concerned? So there are a lot of challenges ahead, and it's always necessary to be, you know, culturally sensitive and things like that. Keep an open mind, and
That's right.
and the bottom line is just be there for your patients.
Definitely. Now, I understand you even took off a little time to take care when your wife was pregnant. Or
After our baby was born, I took about a year off.
Now that itself, this is good for doctors to know that this is wonderful, because the relationship that you have with that baby and your wife, you were telling me even when she was in the hospital, that there was some dissatisfaction how people are treated there, even knowing that she was your wife or such.
I think you definitely, that vulnerability was very palpable, you know, especially when my wife was being a patient and things like that.
Yeah, right.
And I definitely could understand the flip side of it, being on the patient and being the caregiver for someone who's going through something.
Sure.
So it definitely lended a different perspective on things, and even while taking care of my son, I could definitely understand like why people would get frustrated and things like that, because we only get them for like small chunks of time, 15, 20 minutes.
That's right.
And the caregivers are really have to be there, and it's a pretty draining experience.
Surely.
So I definitely understand when they approach the doctor, when they're looking for answers and things like that, how things could come out as very frustrating, and so it definitely taught me to kind of take a step back, you know, and not take things too personally, but really look at things kind of globally and say like, okay, what's going on? Let's try and get to a nice spot and things like that, because I think physicians are emotional creatures too, you know, and if we get off on the wrong foot, then it could be a very, you know, antagonistic situation.
Oh, yes.
And you could look at that patient from here on out, you know, in a very negative light as a complainer or something, this, that, unless we take ourselves a little bit away from it and say like, okay, they're in a lot of pain, they're in a lot of distress, we should really try and do it. So I thought that was a pretty powerful experience.
Well, you know, the thing is that I have often found doctors don't take time to, even when they see a patient, to walk out the door and see the person who brought them to the hospital, to the clinic, the caregiver or a relative. They feel more personal if you just take 2 minutes to go out and say, well, we saw her and everything's looking pretty good, and we're going to keep her on medication, because some of those folks have to be given the medication by somebody else. And so, therefore, if you take that time to let them know that they're part of the treatment rather than just being an observer. You know, I one time told people, don't bring any flowers to a patient in the hospital, and don't bring any cards. I'll tell you what you bring. Bring a washcloth that you just bought that's really fuzzy, and when they come to the hospital, take the hot water from the base sink, make a nice compressed washcloth, and wipe their face, around their ears, around here, and so forth. I said, and then wash their hands, because they lay there all day in the hospital with their hands that might be contaminated from sheets and things like that.
Yeah.
And I said, and wash their feet. Just wash their feet. Now, that will all take about 2 minutes, 3 minutes. But that patient will respond more to eating, to all the other things that will happen during that time, because of the one person, and you are the physician that can do it. You know, they make them accept the hospital and things like this. And so, and the other thing I told them to bring, the washcloth, I told them to bring some aromatic oil, and just take and let them sit up in bed if they can, or if they can't, and massage around the shoulder as such with an oil. Aromas do a lot for healing.
Absolutely.
Aromas, you know, and that's so important to let them know that you care that way. And the other most important thing, go to a drugstore before you see your loved one and get some sticks called glycerin sticks. They're things that on a tongue blade that you can clean out the patient's mouth. Because that patient is laying there for days. If you look at that tongue, it is horrible. Because the tongue is multiplying like mad cells and so forth. It's brown, it's stained, it's not tasting, because the taste buds are all hidden down underneath. And you just take a toothbrush and take that little mess off that tongue and let them rinse their mouth. You've done 3 things that will get that patient out of that hospital faster, you know, than all the other things.
Absolutely, yeah.
Yes.
I think it's powerful, a lot of things that you mentioned, because I think, like you were mentioning before about the touch and the healing and things like that, it's very palpable, and it's very part of like what we have to do.
That's right.
You know?
Well, I'm like I said before, talking with you even before coming on a television program, just seeing you in your family practice and things like this, I'm sure your patients really cling on to you once they get you, and if they have a substitute, they don't feel it maybe as comfortable sometimes. But with all the background training that you've had, it really plays a great role. I was telling the dean of the school not too long ago that, and I think they're going to start changing the curriculum, rather than all of everything based on biochemistry, anatomy, and the students should be prepped a little bit about being a doctor. In that first 6 months, maybe.
Absolutely. I think that's key.
You know what I mean? Because they're only here 4 years. You know, 4 years is a short time.
It's a very short time. It seems like a big daunting thing to other people who are looking at going to medical school.
That's right.
But in reality, it's a very, very short thing.
Yeah. Well, I know in your department, Dr. Miriam Vincent, who I've known for 35 years, even as a student at York College, and
Right.
she got a master's in electron microscopy even before she even came into medical school, of course, and
Right.
did all the other things, and PhD and all these things like this. But she's an excellent role model for you,
Oh, absolutely.
as you see, because when you think about the applications you get in your program, it's 6 places with 2,000 applicants.
Mm-hmm.
That's unbelievable, isn't it?
It's absolutely unbelievable. Yeah.
Yeah. And so what do you think about the government as far as expanding or trying to encourage when they give scholarships or things like that to people who want to come into family practice? And rather than, oftentimes you said you went to St. George, but oftentimes people have to go out of the country to get their degree and come back, and yet we have all the facilities and things right here. Why should they have to leave?
Yeah, you make a great point. I mean, there's a lot of good young people who really want to help people.
That's
And
right.
want to be physicians. And I think that they, as our healthcare needs continue to grow,
Surely.
we need more and more physicians, and we need to train more and more physicians to kind of come out there. And we have to really do a good job of promoting what we do in primary care, especially family medicine,
Right.
and kind of really show that we do make some really good, excellent strides and things like that, and we make some powerful impacts in patient lives. Yeah.
Oh yeah, well, you know, with the new health reforms that are going on right now, people have their attitude of what's good and what's bad about reform. If you don't reform anything, it stays the same form. It doesn't shape up too much, you know?
Right.
There has to be some reform somewhere along the way because we're only here on this planet for a very short period of time. And
Absolutely.
basically, if you can't give a person quality of life, not just quantity, but quality of life, because if you just look at folks who are really suffering, I'm talking about Haiti, for example, right now. It's all right to go over there for a doctor to go a week, 2 weeks, but those people are going to need that for years. That same kind of care that you go for 2 weeks or something
Absolutely.
like that, you know.
It has to be sustainable.
It has to be sustainable because they're living in tents now, rain season and all this kind of thing.
It's coming,
Imagine eating in the rain. You know, where people had houses. And people don't realize that Haiti had universities. They had medical schools. They had all these kind of things that we have right here in a little island like that. Do you know what I mean?
Yeah, absolutely.
And so they're some very sophisticated people.
Oh, absolutely.
Sure.
Yeah, absolutely. They got independence shortly after we did in the United States, you know. So,
That's right, surely.
So I mean, if the Haitian history is quite remarkable, and like you said, that they built a nice little society over there, and a lot of the infrastructure has been devastated over there.
Surely.
So we really have to help them out, and I think it's a long-term thing, like you said, and that's what I think what the essence of family medicine is really about is really not just looking at the acute issue, but really looking long-term.
There you go, sure.
And taking it out. So just the example of family medicine, you could apply it to a bunch of different fields and disciplines.
Sure.
When you're building society, it's not just for a quick fix type
Right.
of thing. I mean, there are certain situations that do need a quick fix, but a lot of our things really need long-term, sustainable
Oh, yeah.
solutions.
Even when they get out to the hospital, some of the folks can't get back for even their appointments because of certain things, you know. During my practice, I made house calls. And I made house calls. I lived in the community where I lived for, when I practiced for over 40-some years. And I lived upstairs and I had my office downstairs, you know.
Right.
And so therefore, I was there 24/7, 365 days a year,
Right.
you know. And people could come and knock any time on my door. And never did I turn a person away, even if it was a Sunday afternoon and I was there.
Right.
I would see the patient.
Sure.
You know?
No, yeah, that's.
And it made them feel so much better that we have doctors in the neighborhood rather than just clinics. What do you feel about that?
Yeah, I think it is. I think we have to be interwoven into the society that we're a part of, and
Right.
and it's not just having your clinic hours. It's going to the schools. It's doing this, going to the other things, having fairs, going to other kind of cultural things, and really being part of the fabric of your society, really, and being
Yes.
really interwoven into it, and saying that you're part of it.
Right,
And I think that's what's really and you yourself will be a better physician because you'll understand what are the barriers, what are the things that are really hindering certain health things, or you could see like certain things that are going to really like we could work on this and say like, hey, well, you already have something really good on here. Let's improve on it. Let's
Surely.
expand on it.
Sure.
So I think it's important to really be connected to the society that you are. You can't be, kind of like in an ivory tower, and then you have to be in it.
I mean, it's just like in our communities, they have a lot of small grocery stores, bodegas, they call them, and things like this. Now, if you don't have access to supermarkets and things like that, if you're in the community and you see what the situation is, for example, I used to see children stand outside of the small stores at lunch hour with 50 cents to get a small bottle of some type of non-juice beverage and a bag of chips, 25 cents a piece. That's unbelievable. I mean, and this was their lunch.
I know.
And then you say, why is this child not doing well in school? Or why are they acting up? Or they're hungry.
They're hungry, absolutely. They're hungry, yeah. And these are some things as physicians, I think we sometimes forget that we do have some like real power, and we could address some of these issues.
Yeah.
It's hard to address all of them,
right?
But I mean, at least we could if each one of us picks like one or two, we can make some changes in our society.
I think so. I think that medicine is taking care of a total human being. It's the psychological part of it, and I know you must spend time talking to your patients about their history of what do they work at and things like that. That's what family practice is all about. You were telling me before. You want to know what kind of job they're on. You want to know all these kind of things.
Oh, absolutely. I think it's important to really understand. It's not just the kind of like whether it's manual versus sitting at the desk.
Right.
It's also the stress that's associated with each person.
That's important. That's stress.
Yeah, that's really important for us to really hone into on, because a lot of things that are really affecting us are stress related.
That's
and
right.
and only very recently are we really we built into our society that saying that stress is good, work is everything, and
Right, yes.
and we made this accelerated society.
Right.
In the midst of all that accelerated society, we have like increase in sedentary environments. We're spending more time at work in front of computers.
Right.
There's a lot of stress. We're not exercising as much as we used to.
Right.
Our diet is not good. We're drinking a lot of these caffeinated beverages.
Yeah.
So they all kind of play, and it's a lot of the driving thing is I need to be the best. I need to do this. I need to do that.
Sure.
And people are coming in very frazzled,
Sure.
very stressed out, and like they might not be having anything and it manifests lots of times into physical signs.
Well, I had a patient. She came in one time when I was in the beginning of practice almost, and her eyes were bright, and she was shaking and so forth. And getting the history, I said, well, do you drink coffee? And she said, yes. I said, all right, well, how many cups? She said, well, over a day, it might be about 17 cups of coffee.
My God.
Now, in coffee, a cup might have 50 to 100 milligrams of caffeine. Think about that. Now, her nervousness and things had not to do with a disease process, but what she was
putting into her body.
So if you just ask what they're drinking,
exactly, and
like you were just saying.
And you see some of these.
My God!
And the size of things have expounded it, tremendously.
Yeah.
Probably that 17 cups of coffee was probably this big.
That's right.
Now you see people who, I just have 2 glasses of coffee, and then you have to really ask, and it's like some big, it's like for the size of an elephant or something.
Well, all you have to do is go to the theater, and they come past you. I'm sitting in the aisle. They got a big thing of popcorn here and a great big Coke something here.
Exactly.
They're trying to get by you because their stomach is like this. I have to get them out of the seat.
Yeah, absolutely, yeah.
And so the theater's not doing too good. What do you think about putting a tax on beverages if they're one of these kind of things?
That's a trickier subject. I mean, I definitely understand the thought behind it, to kind of help people with their health and things like that, which is the ultimate goal. But I'm a big person of freedom of choice.
Okay,
yeah.
Okay. Sure.
I think people should, and I think we should have people who are taking care of these kids. I think that's who it's really kind of targeting.
Right.
The parents really should be having a more active role.
Surely.
I mean, the way that these kids get these juices is because the parents usually buy them.
Surely.
So. I understand, trying to hindering that by using the tax, but I think I think it kind of disempowers parents a little bit.
Right. Oh yes. Right.
I mean, that's kind of my perspective.
Right.
And it's an interesting idea. It's an interesting thought. But I definitely feel like the ultimate thing should be up to the parents. And I would definitely want to instruct the parents and kids also.
There you go. Surely.
You know, and empower them to make those choices.
Surely.
Because I think that's what makes a better society, when we have people who are informed
Right.
and making clear-cut choices rather than something that's imposed on them.
I agree. And Dr. Anger, I tell you, being a family practitioner yourself now in the department here at Downstate Medical Center, I'm so glad that you were one of those 6 that they chose to take out of thousands of applications, and you've had to show them that you were worthy of coming here and at practice and so forth. So I want to thank you for
having
being
me.
with you know.
Thank you for having me. Appreciate
I hope
it.
Next time we'll have a more important discussion too. So you folks out there, choose your doctor, choose them well, or choose her well. Make sure that they're taking care of you, not just saying hello, but by putting a stethoscope, taking your blood pressure. They got to take care of you, because you got to take care of yourself.